Good evening, everyone. So I think we discussed about the introduction part to child psychology, correct? So we can you just recall what we discussed? Just think what and all we discussed, and then what are the chapters that are coming in for your syllabus as a part of your syllabus. What are the chapters that are there? It's very important for you to have the syllabus with you so that it's very easy for you to remember the concepts, right? So unit 1 we discussed about what is child psychopathology and what are the historical nature of it. Now in this class we shall understand about a bit of introduction to what is child psychology, right? So the current field of study for childhood mental disorders is often referred to as child psychopathology. However, in the last class I discussed what is pathology, right? Pathology is nothing but the diseases that a person can get, and psychopathology is the diseases that children can get, and it is called as child psychopathology. The current field of study for childhood is called as child psychopathology, and like I mentioned, this is the growing branch of psychology, because not earlier they thought that whatever adults used to get the disorders, even children were having. And earlier they also had a notion that children can never get mental disorders, but it is proven wrong. And nowadays children are also suffering from mental disorders, which the parents will have to definitely take care of, right? So involves the study of psychological and behavioral disorders in children and adolescents, right? So here it is not only about small children. When we talk about psychopathology, it is not only about small children but even adolescents years, the teenage years from say 13 to 18, whatever age group of students are there, they also come under the category of child psychopathology. Now in order to be considered as meeting the definition of mental disorder, there must be a pattern of symptoms, right, which leads to some kind of distress. Now when do we say that a child is not feeling well, or when do we say that the child has abnormal behavior or abnormal disorder? Is when the child is not able to function properly, and the behavior of the child is bringing in lot of distress to him or her, and it is affecting their growth period as well. So it leads to some level of distress, disability, or interference with daily functioning. Generally, what do we expect from a child? The child has to be active, and then the child has to go to school. It should have the capacity to learn just like how the other peers are also learning, of the same age group, right? And play well, right? And then again complete the homework, do the task of their age appropriate, and behave age appropriately, right? But in disability, what happens? All these things are hampered, or interference with daily functioning. Like in mental retardation, the child will not be able to do their task, any of their task on their own, right? So even for toilet training also it is very difficult. So, and an increase in the risk for pain, suffering, and loss of freedom. So because they will be institutionalized in severe cases of mental retardation or autism, right? So institutionalization also happens, wherein you just leave the child in that place, and parents will visit the child once in a while, and to see how the child is, right? So definitely the child is in pain, and it also suffers, because if the child is not performing well, and if the developmental pattern itself is hampered, then definitely the suffering is a lot, right? So therefore, in order to be considered as meeting the definition of a mental health disorder, there must be pattern of symptoms. First of all, if autism is there, if you want to diagnose the child with autism, there should be certain set of symptoms, and that those symptoms should lead to the level of distress, disability, or interference with the daily functioning of the child. And the child must be in pain, the child should suffer, or should have laws of freedom, that is the institutionalization. And how are the symptoms? They are not consistent with the norms of the culture, though they may appear to be the exaggeration of normal behavior, or can occur in adaptation to some unusual circumstances. The sometimes there is a very thin line difference between the child's behavior, the normal behavior and the abnormal behavior. Say children sometimes exhibits aggression also, right? They become aggressive if you don't give them certain things. They don't know to handle emotions, which are very much normal. We need to be very careful while diagnosing that as a problem. And therefore, we have something called as DSM. It's the Diagnostic and Statistical Manual of Mental Disorders, and it was originally developed as a taxonomy to categorize these patterns into mental disorder. We have already discussed this. We have DSM and eyesight is for and is also in its fifth using, and this DSM was started by American Psychological Association, right? And ICD-10 is a book which has related to as numerous disorders, usually first diagnosed in infancy, childhood, or adolescence. Some of the common disorders in children is of anxiety. Okay, so the DSM-4 lists numerous disorders as usually first diagnosed in infancy, childhood, and adolescence. And we talk about various disorders. Some children can also get addicted to alcohol, and some children can get into anti disorder, and child may develop anxiety, separation anxiety. The child may be having fear about, though in some instances they may not be diagnosed until adulthood. Some form of disorders may not come into picture at all. Probably parents would not be vigilant in understanding or not be diagnosed at adulthood. This review will focus on childhood mental disorder commonly seen in populations, including mood and anxiety disorders. AD, a common problem, that is, the child will not be able to focus on one particular aspect for longer time. They keep moving here and there, and they'll not be able to sit, they'll not be able to concentrate, or they may even develop pervasive developmental disorder, which is it includes autism, Rett's syndrome, right? Come in the way of their usual development. And 10 to 20% of the youth meet the criteria for specific psychological disorders. So wherever you go, whichever statistics you take, most of the children also, just that identification goes missing in most of the time, or as I told you, parents might be in the denial stage. And unfortunately, the majority of children with mental health problems do not receive services. It could be the negligence of parents or lack of availability. Now, say for example, villages, if you take, there are no mental health hospitals as such. And imagine there are children with autism or mental retardation or learning disabilities. Then, if proper care is not given to such children, then definitely they will not be able to become an independent adult. So that is again unfortunate, and about 20% problems will have significant difficulty throughout their lives if proper support is not given. Then definitely they will be completely dependent on the caretakers, and the severity of the it will affect them to adulthood. So once the child is mentally retarded, it definitely be retarded throughout life. It's a condition where you cannot be, where you have a cure for it. Now, if we recover from it, but if a child has yeah. Fine. So about 20% of children with mental health problems will have significant difficulty throughout their lives, and it is long lasting and will continue even in adulthood as well. But then the early detection of the problem is very, very important. If early detection of the problem is not there, then definitely the child, say there is something called as critical period during the developmental stage. If that critical development for language or any skill, if the child has to acquire those skills, then at that particular age itself the child has to acquire. Otherwise it would be problematic for the child to acquire those skills. So parents must be vigilant enough in order to take care whether the child is attaining all those skills or not. Otherwise, say for example, in autism, what happens, the child will never make eye contact with anyone. They will not go with anyone. It could be their mother, father, or whoever it is. They just want to be alone all the time, and they will have uh, stereotypic behaviors as well, and self-injurious behaviors also they have. So these kind of symptoms should be noticed right from the beginning, so that proper special schools will be there to help, right? So nature of the child psychopathology, it is the manifestation of psychological disorders in childhood and adolescence. This is the definition. Say examples of child psychology may include ADHD, ODD, it is called as oppositional defiant disorder, and pervasive developmental disorders. There are other various kinds of disorders as well, but these are some of the most prevalent ones, which we will be studying in depth in the further classes. Now, what are the factors that are compiling or complicating the study of child psychopathology? You just think what could be the hindrance factor, right? So first is American psychiatrists suggest that children were less likely to suffer from mental illness because the immaturity of their developing brains would prevent them from retaining the mental events that caused insanity. So fortunately, psychiatrists do not think this way. So initially what they thought was, anyway the child is going to develop, right, over a period of time. Now the child is small, the child may have a certain problem, but then over a period of time when the child is developing, their brain will also change and the disease will slowly fade away. This was the notion that earlier psychiatrists had, or earlier people had, which would actually complicate the study of child psychopathology. But then now they have identified that no, this is not true. The severity of the condition worsens over a period of time as the child develops if intervention is not provided at the right time. right? So that is why psychiatrists do not think like that. Initially, the notion of child psychiatry and the understanding of child psychopathology, even for that matter abnormal psychology, they felt that it is demonology. Demons would have possessed people, and that is why they are behaving in this way, right? So that was the understanding that people had. So for that, there is a lot of changes that happen, and now slowly the child psychology, the child psychopathology field is gaining importance, right? And this is a blooming area wherein the child psychopathology paper is also there, which if at all you are interested, you can take that as well. And recently interest in child psychopathology has increased, and this is due to the growing realization that many childhood problems have lifelong consequences. Now that slowly people have started realizing that yes, children need treatment, otherwise it will have long lasting effect on them, and it will definitely cost for both the children and for the society. See, if we have such children, then definitely for them also it is painful. There is a lot of stress. Even for the caregivers also there is a lot of stress, right? And even for the society also there is stress, because they are a kind of burden to the society because they are not being productive enough, right? So therefore the demand for child psychology has increased over a period of time. And what can you expect out of children from these kind of problems are very limited. So the main thing what we can expect out of the treatment for children with problem is that they will have to take care of themselves. They should be able to meet their basic needs, right? So therefore, um, for society, that most adult disorders are rooted in early childhood. Now, it is not only about the childhood disorders, but adulthood disorders also. Say, for example, schizophrenia, depression, anxiety, whatever it is, people believe that even those kind of problems have roots in the childhood. That is, if a child has undergone abuse, say it could be different kinds of abuses, it could be sexual abuse, verbal abuse, physical abuse, or neglect, and then again that would have had a very great impact on the child, and therefore the child is not able to grow as an healthy individual. And because there is a lot of stress, there are stress hormones released in the body of the child, and that hormone over a long period of time would definitely affect the biology of a person, and therefore he or she may develop a disorder, right? So better understanding of childhood disorder definitely will offer promise for developing effective intervention and prevention programs. Okay, sorry about that. A further complication is that another challenge for childhood disorder is that they do not come in neat package. Now, it's not only about the childhood disorders, it could be any disorder for that matter, even the adulthood disorder also. There is no clear cut definition as such. So that most forms of psychopathology in children are known to overlap or coexist with other disorders. Now, if you check the symptoms of autism with Rett syndrome, then there will be a very thin line difference between those two. Okay, and they are always overlapping with each other. So therefore, there is a lot of complication when we think about the symptoms of the problem. Significance of child psychopathology. What is the importance of child psychopathology? So first, why should we even have child psychopathology, right? So a majority of children who experience mental health problems, these problems will go unidentified or unnoticed, or even if people notice also, they do not give importance to mental health problems because of the stigmas that are attached to it, right? So they feel that if we go to mental hospital, then it is like we are mental patients, and we are definitely not taken care of, and we remain like that forever. So these are the wrong notions that people have. And even for the childhood children also, parents are not okay to call their child as having special needs, right? So they feel embarrassed in front of others to call their child themselves as having special needs or put them in special school. Okay. And only about 20% receive help. So only limited people are getting help, and those with who has a lot of money, or say there are very limited number of special schools, right? So the way you treat the people who treat them are also very less compared to the ones which we have for physical problems, right? And majority of children with mental health problems who go unidentified and unassisted, that is unhelped, often end up in the criminal justice or mental health system as young adults, especially the ones who has oppositional defiant disorder, conduct disorder. These are the ones whom we should be very careful about, otherwise they will end up becoming criminals in future, right? So they end up having antisocial personality problem as well. Now, this can also be learned. The learning theories also explain why a child can become a criminal. So there should be a clear cut difference between what is right and what is wrong. Now, if a child steals an eraser, right, and comes home, okay, it would be a very small eraser, but still the mother should correct that behavior of the child. Otherwise, what happens? The child will feel that it is okay to steal, my mother has agreed to it, so let me steal something else. So first time he would have shown it to his mother, but second time he wouldn't have shown it to his mother, right? So this is how the concept of reinforcement comes when we talk about the behavior of criminals, right? And they are at a greater risk of dropping out of the school because of the gang that they form in future, and learning disabilities also, or because of the anxiety issues, because of all these problems, and they are not getting proper treatment for their problem, they can just leave the school, or they may say that yes, I am going to school for their parents, but they might be going elsewhere. Not every school will have parents teachers meeting, right? So not every school will let their parents know that your child is not coming to school. So it would be parents will get to know only after many days, or the teachers may get to know after many days that something wrong would have happened. So therefore, a counselor in a school is very important, and keeping a track of these students are also very important. Identifying the maladaptive behavior is very important, and we need to be trained in that. And many young people experience significant mental health problems that interfere with normal developmental functioning. Suicide is another very prevalent case for the death in adolescence. It could be because of the marks, the academic performances, or say the relationship failures, so not able to form a relationship, or it could be many other reasons, right? And a significant proportion of children do not grow out of their childhood difficulties at all. Whatever difficulties that they have, they just continue to be in that, although the ways in which these difficulties are expressed change in both form and severity over a period of time. And what could be the third reason? Recent social changes and conditions may place children at increasing the risk for the development of disorders. And say, for example, the environment where the child is developing also is one of the reasons why child psychopathology is increasing. A lot of expectation from parents, or it can also be like too much of love towards the child. Say love towards the child is definitely there for all the parents, but then if it is too much, right, there are 4 different types of parenting styles. Just go through that, and what are the effects of that on the child. Or if a parent is very much unattentive, nowadays use of mobile phones has become a major problem, right? So the child is not eating food, give them mobile phone and feed. The child is not doing the homework, give them mobile phone and then make them do the work. So this is again causing a lot of addictions in children, mobile phone addiction, right? They are not able to concentrate, not able to sit even for a few seconds, right? So the recent social changes and the changes in the environment have brought in lot of impact on the development of the child. And a significant number of children in North America are being subjected to maltreatment and chronic maltreatment during childhood. Not only in North America, even here, right? So a lot of children are abused, right? So we need to be vigilant, and most of the children are abused by their family members themselves, right? So it has been estimated that each year as many as 2,000 infants and young children die from abuse or neglect at the hands of their parents or caregivers, right? So you have seen, even there are many cases where the mother would kill the children, father would kill the children due to whatever reason it is, right? So even right from the, see, that is a place where it is safe environment, right? Home is actually a safe environment for the child, but that itself is becoming a traumatic one, right? So because of all these, child psychopathology is gaining a lot of attention nowadays, right? And you can note down this 1098, that is 1098 is a child helpline number, and if you come across any child going through any problem, you can call to this number, and then they should be able to help you out with it, right? Common childhood mental health disorders, we will definitely be studying about all these in detail later, but these are the just the surface level of it. Anxiety is when a child does not outgrow the fears and worries that are typical in young children. They are not able to come out of that, or when there are so many fears and worries that they interfere with the school, home, or play activities, the child may be diagnosed with an anxiety disorder, right? Examples of different types of anxiety disorder will include being very afraid when away from parents, that is separation anxiety, and having extreme fear about a specific thing or situation such as dog, insects, or going to the doctor. It could be any different kinds of anxiety, and it is not something which is very normal. Okay, the child is so anxious that it is coming in the way of their normal functioning, whatever the child has to do as a normal routine, normal part of routine. Say the child, in for example, in separation anxiety, what happens, the child will never go to school. Okay, he or she will come up with varieties of reasons, or they will just throw temper tantrums when they are about to leave to school. They will just cling, they'll just hold on to the caregiver. They are afraid that they will leave them and go. So there are varieties of problems, and because of abuse also, children may feel anxious to talk to stranger, or and definitely this will have an impact on their academic performances, right? So anxiety is one of the major problem, and the symptom of anxiety, one of the symptoms could be bedwetting or sweating, increased heartbeat, right? They will become mute all of a sudden. They become mute, they do not talk to others, right? And most of the time they remain as loners. They do not want friends. They start avoiding the social situation. So these are the some of the very evident symptoms, and their handwriting, everything gets affected. They'll start lying, right? Being very afraid of school and other places where there are people, so that is called as social anxiety. They do not talk to their friends properly, or if imagine they have to recite a poem in front of the class, right? So at that time they are very anxious. They will not be able to do it at all, and being very worried about the future and about the bad things happening, right? So generally in adolescence, what happens, they will be worried about their future. They'll not be able to concentrate on their studies. What will I do next? Will I be a good son or a daughter to my father or mother? So these kind of questions keeps coming in their mind, and having repeated episodes of sudden unexpected, intense fear that come with symptoms like heart pounding, having trouble breathing, or feeling dizzy, shaky, or sweaty. That is called as panic disorder, which we will be learning again in detail later. And anxiety may also present as a fear or worry, but can also make children irritable and angry, right? So anxiety can take different forms, and anxiety symptoms can also include trouble sleeping, as well as physical symptoms like fatigue, headache, or stomachache. And some anxious children keep their worries to themselves, and this is something which is very, very difficult to treat, because what if my parent will they have a lot of thinking us to understand what the child is feeling. And then comes depression. Is a wrong notion. Children can also be diagnosed for depression, right? So what are the symptoms? They may feel sad, hopeless, irritable a lot of time, and showing changes in the eating patterns, not wanting to do or enjoy the friends or funny things, eating a lot more or a lot less, avoid going outside. There is a lot of low level of energy, they're always tired and sluggish. People may feel that okay, this boy is very lazy, but then they are not lazy. It is because of the condition that they are doing all these. And they may be restless a lot of time. They might be agitated, they may feel very much irritated, they may throw the things here and there, they may have hard time paying attention. They feel worthless. I am fit for nothing. I am useless. There is no hope in my life. They may start feeling guilty and showing self-injury and self-destructive behavior. They may, in severe cases, what happens? They may even harm themselves. It could be like cutting their hands with knife or trying to kill themselves with poison. So whatever it could be, that is committing suicide. Extreme depression can lead a child to think about suicide or plan for suicide, right? So for youth ages 10 to 24 years, suicide is among the leading causes of death. Behavior or conduct problem, again, this is one of the major issues in children. Children sometimes argue, definitely whatever we tell, they do not accept it at the face value, right? They are aggressive or they act angry, they are defiant also, they behave rudely, but sometimes it is very common. However, when does it become a disorder is child's age at the time, and it is persistent over time. They will never ever listen to you, and it is very severe. And because disruptive behavior disorders involve acting out and showing unwanted behavior towards others, it is also called as externalizing disorder, because they are putting out all their aggression on others. They may hit other person, their peer groups, they may not say sorry. They don't even feel sorry about it. They may start stealing, they may start lying, they may start fire setting, they just go and set the fire, right? They may destroy the property at home or in school or in different places, right? So this is the way the conduct problem is appearing in the child, and they are very aggressive also. Oppositional defiant disorder is when children act out the problem, serious problems at home, in school, with peers, and they may be diagnosed with ODD. It starts before 8 years of age, and they are more likely to act opposite to whatever we tell. That's why it's called as oppositional defiant disorder. Say often being angry or losing one's temper and arguing with adults unnecessarily, refusing, they never ever listen to adults, they are very much resentful, they annoy others, they irritate others, they often blame others for their mistake. I did steal because he gave me an opportunity to steal, or something like, why should he leave his pouch like that? So I took his money, something like that, right? So misbehavior is also there. They may even bully others, right? And OCD is another form of childhood mental health problem where the children will have persistent, recurrent thoughts, impulses, or images, which is very difficult to control. And in order to control that, what they do, they will engage in the compulsive behavior. That is, now if I get a thought that my hands are very dirty, I will go and wash my hand. Now, how many times will you wash your hands in a day? But for people with OCD, it would be 30 times, 40 times, 50 times. They may take bath for 10 to 15 times a day, right? So because they are always engrossed in this thought, it's not only about the thought, but it can also be about keeping the things there itself. Otherwise, what they feel anxious. Did I turn off the lights or not? They will get this question. They would have gone half a kilometer. They'll come back, check, go again, come back and check. So having to do something over and over, it could be hand washing, placing things in a specific order, checking the same things over and over, like whether a door is locked, having to do something again and again would be the problem. And when PTSD is when the child would have undergone a trauma or would have been a witness for the traumatic behavior. And after that, post the trauma, it could be earthquake or losing a loved one or any losing a pet can also be a trauma for the child. So what happens here, they will relive the situation again and again. Nightmares, dreams with dreams which will elicit fear in them, and they may not be able to sleep properly. Bedwetting can happen. They become very upset easily. They start crying very easily. They always have negative emotions. They are sad, they are depressed, they don't want to make friends. They have a lot of fear. They don't want to go outside. Irritability and angry outbursts, constantly looking for the threat, and they are easily startled. They act helpless, hopeless, or withdrawal. And for all these disorders, the causal factors are explained in the form of biopsychosocial model. That is, biologically, one thing, temperament of the child. How is the child? Is the child easygoing or difficult to warm up, or is the child very difficult to console or to do any task? And do they have any history, that is father, mother, or grandparents or their generation have any problem, or is there any abnormal functioning of the neurotransmitters? So that could be biological. Psychological is the way they think, the way they decide. And socioculture would be how is their environment, right? So are the parents supporting? Does the child has any supporting system, or are the supporting systems themselves abusing? Do they have good friends? Do they have good family members? All these things, what are the expectations? All these things would add on to the difficulty of the child. Treatment, there are varieties of treatment based on the disorder, right? So CBT is called as cognitive behavior therapy, where the cognitions of the child and the behavior of the child is tackled. Pharmacological is when you are not able to treat the child with normal simple therapy, right? Then medicines, say for example, if the child has intense anxiety or intense OCD or depression with suicidal thoughts, then definitely pharmacological, that is medicines, would be given. Alternative treatment would be like relaxation therapy, yoga, exercise. All these things will be taught to the child in order to manage themselves, right? So this is in brief about unit 2. We can discuss more about all these childhood psychopathology in the upcoming units. Okay, thank you so much.